This video and podcast is brought to you by the Kulkarni Law Firm. Hey everyone, welcome to another episode of DarshanTalks. I am here with the one, the only Moe Alsumidaie. Did I get that right again? I keep asking every single time, but let me sort of do a quick intro, and he can correct me all he wants because it's always true. I butcher everyone's name. I'm terrible, especially considering my own name. Moe is the technology guru. He gets quoted in all kinds of magazines and all kinds of articles. He is he works with technology vendors all over, and he works at the clinical trial site level, and is the go-to person to ask about clinical research and technology. But that's sort of how I think of Moe. Moe, how would you describe yourself?
Appreciate the introduction, Darshan. How would I describe myself? Well, I'm very close-knit to the latest technologies that are out there. I run a computer data science team out in Jakarta, and I'm constantly exposed to the latest and greatest in terms of what's coming out from a data science perspective. So as chief data scientist of Annex Clinical, I have to be on top of whatever's going on in the industry. And so that's kind of what my exposure has been so far.
Love it. And you are, as part of Annex Clinical, what are the areas you find yourself sort of digging into?
We're certainly seeing, predictive analytics and machine learning has been, around for quite a bit, but of course now you're seeing an explosion of AI everywhere. You go on social media and you see people like, AI drawing art, AI drawing like a way better picture of what anyone would look like in real life, right? To the point where people started to make memes of everything, and it shows like, pretty funny things. But there certainly is an explosion of AI happening out there, and the differences between AI and machine learning is that AI uses machine learning to teach itself and continually learn. So that's what I think is really interesting. There's some sort of like, unpredictability to it, because it can generate something completely creative out of machine learning, which I think is really cool.
I agree. And the reason I think it's really cool is because for the most part, we've been dealing with AI that some would say is, how should I put this? Everyone's talking right now about open chat GPT-3. Now it's 3.5, and everyone's talking about, is there 4 coming out? All that good stuff. But the point I'm talking about there is people are excited about what AI can do. And I've had some limited interactions with the AI system right now, and I found it to be relatively regurgitative in that it sort of took the information that's out there, gave you a new summary, and it can do that for a lot of different types of information. It's sort of like the smartest person who knows nothing. And I find that to be such a fascinating way to think about it. It knows a little bit about everything, but nothing about anything. And unlike the AI bots you discussed a little bit ago, where you were like, oh, they'll spit out an image that's brand spanking new. To me, there's something valuable about that. There's something interesting about the idea that a system can generate an image, and it's unlike one you've ever seen before. To me, there's an original thought that goes with it. And there's been some copyright law type of analysis, which goes, well, can you actually can you actually copyright something that's created by an AI? And some jurisdictions have come out and said, no, you can't, because that's not created by human intuition, by humanity, if you will. There's another school of thought that comes in and says, if you did create this type of chat, is it protectable in other ways? And people are still dealing with those issues. But right now, the big thing is using these chat bots, if you will, to help simplify the processes we already have. Do you see a role of AI in clinical research? We're in the very, very early stages. So let's say in the next year, do you see people deploying OpenAI or other chatbots in the clinical research realm?
It's a good question. And going back to your, original content, right? And, an AI creating it change, like a new image, right?
Yeah.
So what's interesting about it is that it has to use machine learning and an existing set of data to create something that's subtle and different and original. Yeah. It's not going to create its own thoughts about something, or opinions rather, but it's really going to state things in a different way, but still says the same thing that it has already learned, right? Mm-hmm. The next stage is going to be formulate opinions and predict, future like humans do, right?
Right.
And I think that's down the pike. And we'll be there very soon because, predictive modeling and predictive analytics will be like, for example, I estimate that my study is going to end on this day, right? Like, what's from an AI to, limit it from predicting what's going to happen based on existing data that it already has collected. That's going to happen, right? For clinical trials and where we currently are, what I think we can use an AI for is limit it within the confines of the data that we feed into it to provide operational solutions. For example, instead of a CRA being on call all the time asking, when someone asks a question about something that might be protocol related, for example, you can train an AI to, give it the protocol, give it the IB, give it whatever information you have, and it'll work within the confines of that information to provide, for example, coordinators access to information through a chatbot, or if the patient has questions about the study itself, you can also train the AI to, within the confines of the study to provide that information to patients. Now, the challenge then becomes if anything is patient facing, it's one thing to be site facing. It's no big deal. IRB, right. But with patient-facing information, the IRB has to maintain control over it. And I think that's where we would run into challenges, because if the AI is creating original content, even though it's based within the confines of the data you feed into it, there's always the risk of a patient saying something that could potentially be an adverse event, or something that some IRBs would approve, other IRBs would not approve, that's sort of like, outside of the confines of what is controllable. So that's where you can run into some snags, especially when you're dealing with patients.
I love some of the concepts you brought in. So let's talk about a few of them as we continue. So you talked about this idea of an operational, them being operational solutions because they work off of old data. One of the pieces that I found interesting is we were talking about the images and the original images that it's creating, and a lot of people are saying, no, that's not okay, because I don't want my these chatbots, if you will, for lack of a better term, or these AIs were creating images that were stylistically very similar to previous artists. And these artists came out and said, I don't want my images to be used like that, because I don't want you creating images that are like mine. And I don't blame them for that. So my question becomes, will we see a resurgence in copyright claims, especially by sponsors and the like, because the AIs will have to learn on systems? And will people come back and say, no, you can't learn off of my systems because I consider them to be copyrighted? And does that limit the functionality of AI? Does that limit the ability of AI? Does that limit what we can do for sponsors, for CROs, for sites, and for patients?
Well, it's a good question, because what you feed into it sort of comes out, right? So, for example, like go onto TikTok and you see these TikTokers who are very frustrated, almost like, mentally unstable to that point, where they're like, well, all of my original content, which I think about and I spend all this effort thinking about, is copied by someone else, and they gain virality from it. That's one thing, right? That's in the public domain. But in the private domain, where all of your study information is confidential, you can operate within the confines of your company, within the confines of the study, to generate that content. And sure, you can, you can have some issues with copyright if it's used from someone else. But I mean, technically, from that point of view, like if you are including public sources, I mean, it's original content. How could you have copyright infringement on something that's original? I can take data from one piece and data from another piece, right? Two data pieces, feed it into the AI, and it'll generate original content. How is that copyright?
Interesting question. I'm not a copyright lawyer, but it tells me I do need to bring back my copyright attorney friends back on. The question we start dealing with is, it's not that you created an original piece that might be called what's called a derivative piece of art, but it's the fact that you built it off of my original piece. So, for example, I couldn't go out there and create Dumbledore's Adventures because someone wrote Harry Potter and Dumbledore belongs to Harry Potter. So, yes, my Dumbledore's Adventures might be original, but it's based off of someone's original concept.
Mm-hmm.
So one might argue that, and again, we'd have to ask a copyright attorney more about this, but one might argue that the fact that you are basing your new output on someone else's actual original creation is where you start creating problems. Now, the real question becomes, was their creation itself original? Because most attorneys I know will be working off of templates and building their own as well. So
let me ask you this.
Yeah.
What's the difference between an AI creating an original piece of content from an article versus a human rewriting essentially, what someone else is saying, but referencing it, in the form of a bibliography or a reference? Like, what's the difference here? Like,
it's I was just reading this somewhere else where someone said, you copy one thing, it's called plagiarism. You copy 15 things, it's called referencing.
Exactly.
And that's what you're talking about. I think the difference is how much you copy. The difference is how much you base it on. The difference is how much original thought came out of it. I don't think there are any clear lines that delineate when something crosses over. But obviously, for example, if you're talking about stylistic pieces of art, it's very clear that you take who's Dali, for example, with the everything's drooping and stuff like that.
Yeah.
And AI creates a whole new piece of art. It's very clear that almost nothing's copied one-to-one, but it's a Dali-esque piece.
Mm-hmm.
So one might argue that yours is a derivative piece of art based on Dali. Now, have other artists gone in and created that? Maybe, but you're inviting problems. In my experience working with sponsors, working with sites, you want to avoid the problems. You're not trying to go, I'm on strong legal ground. You're going on, can I avoid the problem so I can focus on what I do best, which is research.
So let me ask you this. What does pharma care about plagiarism if all they care about is the results of their medical product?
Well, do you own the results of the medical product if it's based on problems that you didn't own the AI that created those results?
Perhaps you can rephrase that in another example, because I'm having a hard time trying to understand how that would work. I think I know what you're saying, but I just want to get more
I'm
clarity.
still playing around with this. It's a new concept for me as well. So feel free.
So like, so I think so if an AI is used to essentially attain medical product approval,
Sure.
right? Like, so, I mean, let's say that an AI is used to engage patients, for example, right?
Sure.
And the AI essentially, this sponsor gets better patient results because of better engaged patients, right? What's the difference between that and like a service provider that provides that service, to a sponsor, making them more competitive?
That's to me, that's less. That's way more into the gray area. Let's take a less gray piece, and let's start from the less gray piece and build from there. The less gray piece might be, let's say you set an AI loose, and it starts. It goes through a academic university's network, and it starts crawling through the network, and it learns off of what's in that academic site, if you will. It creates a new molecule based on that academic work, right? Here's something that you would like, Mr. Sponsor or Miss Sponsor. You then go back out and you look at it and you go, this thing's eerily similar as a sponsor to a product that I had given for research to that site. They had my IB, they looked at the IB, and this AI based part of its concept on what I had created. Now the question becomes, would the AI have discovered what it discovered without my technology? And there's no way to know because it's a black box. But it gets awfully close. Now the question is, would it matter whether it was done by a university professor or by the AI itself? I don't know if you know the answer to that question, but it raises questions. Go ahead.
It's a good question because, I mean, we're seeing sponsors right now actually using machine learning and AI to crawl real world evidence data to generate and uncover gaps in therapeutic care, right? We're seeing that happening already. Now, if a human discovered that, right, that's the same discovery. The real question then comes into, okay, well, the data's out there and the discovery's out there. Like, can you patent a discovery? No, but you can certainly
patent discovery. Why couldn't you patent discovery?
If I did, so let me ask you this: you're the lawyer. Like, let's say that there's a gap in patient care, right? Like, I'm a cancer patient and I'm taking Avastin, and then I take another.
Penicillin, just for argument's sake, aspirin, doesn't matter, but yeah.
Right. Like, and I discovered that there's a gap in care, right? Can someone patent that there's a gap in care?
Yeah, all the time, every single day.
They can. Okay, so then that brings into question, like, who would own that? Like, whoever owns it, whoever discovers it first. Like, is the gap in care subtle or is it specific? And
so the standard is you need to meet certain patent standards. So it has to be novel. It has to be non-obvious. So novel basically means on its own, it's not a copy of something else.
Yeah.
So it was Avastin and aspirin ever used in any way before? And if you can't find that, you probably are going to get past the novel requirement. Now, was it obvious to someone skilled in the art to combine Avastin and aspirin because you were using Avastin and naproxen, for example, before? And you go, yeah, I haven't never tested it on aspirin, but they're both NSAIDs, and maybe the aspirin's a slightly off NSAID, but it's close enough. Would that be obvious to someone skilled in the art?
Well, do physicians patent their treatment methods?
No, they don't. But that doesn't change the fact that they could patent those treatment methods.
Right. But that's the reality of things. Is I've never seen. Maybe it's so far away from my field, but I've never seen someone going in and patent a therapeutic gap.
Let me rephrase. physicians don't patent it as we stand. But then there are physicians who go, oh, no, I'm going to patent this. And then they get the patent.
Mm. So it is happening out there.
Oh, it happens every single day.
Yeah. Okay. So then I think then it comes to question whether, how specific the discovery is and whether it conflicts with something that has already been discovered by someone else.
Correct.
Right. And ultimately, biopharmaceutical device companies, they pursue product development, right?
Yeah.
They discover and they pursue product development. So if they want to pay a patent, especially if it's big pharma,
if
they see a huge opportunity, they're going to pursue it, right?
But we're talking about more aggressive versions. What happens if it's less aggressive, which is you're on the defensive, and you've paid for the patent, you've paid for the innovation, and you've basically made the discovery, and then you've told Dr. Smith at Harvard, do this work for me, because Dr. Smith is the expert, and now Dr. Smith's computer gets crawled, and now your patent that you'd shared under a confidentiality agreement with Dr. Smith is used in a specific way. Does that create problems in that innovative step? And I think those are the questions we're going to start dealing with. It's funny, when I started this conversation, I thought we'd be talking a lot more about the role of AI in clinical research. And what we're talking about is the role of AI in preclinical research, which is kind of funny.
Absolutely. And it really is an interesting field and an interesting space because it's changing so fast. Yeah. And we are seeing pharma companies doing this. I mean, what's the difference now between patenting, novel therapeutic discoveries and, securing a website back in the 90s, right? You can create an entire company going out there, finding therapeutic discoveries and patenting those. And then
people did. They're called patent trolls.
There you go. Oh, patent trolls for drug discovery?
You have patent trolls for everything, but that's not even the direction I'm going. Patent trolls basically just own a bunch of patents, and they'll prosecute based on the fact that they own those patents or have control rights to those patents. But we're talking about a slightly different version of that, which is what happens if you've got a bunch of, for lack of a better term, platform technology that could be used, but you aren't the one doing it. Mm-hmm. One might say that's brilliant. One might say that is exactly where you want to be, where you control the technology that's tomorrow's future, and you just haven't gotten to it. What happens if that innovation is by an AI and not by a person? Right. Do you still get to make those same claims to innovation? Mm-hmm. And the general theme seems to be, at least in the copyright world, the general theme seems to be no, you can't protect it. Trademark, it wouldn't matter. Patenting, it very well could, but I haven't seen or heard of a patent case where that became an issue. Because this type of technology is so spanking new, there's nothing out there on this topic yet, as far as I know. Mm-hmm. But yeah, so the question becomes: is AI going to change? Well, I think that's the topic for today. Is AI going to change innovation in pharma, or has AI changed innovation in pharma?
It certainly will. If big pharma companies are pursuing this, using these methodologies and technologies, it will change, if not already changing it. So,
well, the question is though, what's the value of innovation if you cannot commercialize it? Because you can't commercialize something you don't own.
Well, if there's something that's aligned with your therapeutic indication, but you didn't know that a patent existed out there for it, or that you even knew that this existed. Mm-hmm. There's definitely, and then you start pursuing, creating a new medical product in that gap. Then
no, but let's take exactly the example you're talking about, right? Which is
if you're ahead of the pack, and you discovered something that no one else has, or became aware of a therapeutic gap that no one else has been aware of through, the use of AI, then you're ahead of the pack if you're creating a medical product that'll address that particular gap.
So here, I'm going to give this thought, and then we're going to have to come back to this at some future point because we've run out of time. But here's the takeaway. If I am a pharma company and I came up with this innovative idea, I came up with Avastin plus aspirin gives you a treatment for diabetes that you'd never seen coming. But I cannot commercialize it because anyone can copy Avastin plus aspirin. Do I, as a pharma company, want to spend the money, because it takes billions of dollars possibly, but at least several hundred millions of dollars to bring a product to market? Am I going to bother doing that if I don't have exclusive rights to it? The good news is there's still exclusivity, but it does dramatically decrease the options available to pharma companies. So something to think about. Mo, I think I'm going to call it because we've both got a tight schedule, but this was amazing. Thank you as always for coming on. Thank you as always for talking. Any parting words?
I say keep pursuing the newest technologies out there. I mean, granted, we've also become a lot more flexible with the introduction of decentralized clinical trials and new concepts of applying new technologies. I say just think about how you can apply AI, and of course, consult with your legal departments if you're going to do anything or run a pilot. But, I think that there's a lot of opportunities in clinical research, despite how rigid of a system it is. Think hard about how it's going to impact your patients. So those are my parting words.
I love it. Thank you again, Mo. Thank you for coming on.
I appreciate it, Darshan.
These conversations are not intended to be legal, regulatory, or clinical advice and may not be right for you. These conversations are intended for educational purposes only. Conversations on this forum do not create an attorney